particular section of surgery. The fingernails, we've got pretty much 3 major types of procedures that are performed. The debridement, excision, or nail bed reconstruction. When we're talking about the nails, either of the fingers or the toes, that's where those, the T1, T, or F, the toes and the fingers, those specific modifiers may come into play. So keep that in mind. They are listed there as well. For the breast, there's again about 3 specific procedures that are performed: mastectomies, biopsies, incision, excision, and this is usually done by needle aspiration. We'll take a look or a walkthrough of the CPT manual, but each of these sections are kind of set up or arranged the same way. They all pretty much begin with incision and drainage, follow those subsections that are inside each individual, or sub-classifications under each individual subsection, are simply or somewhat arranged in the same order. You'll see as we, and it's pretty much just pertains to these 3 sections for the most part. In this particular section, in the integumentary, we talked a little bit about sometimes you have to calculate measurements. Sometimes you have to differentiate whether it's simple or complicated or what they consider complex. There's a lot of guidelines. Some you're kind of taking a look at the entire procedure and grouping. You know, grouping, if there's more than one procedure performed on which areas of the body, and you're grouping them, wherever the most complex or complicated procedure is performed, that is the first one that's coded. Whatever is the most, let's always consider those resources. Which procedure requires the most resources? Geez, is it the simple repair, or is it the 6 inches that was, think of it in that way. Which one is using the most? So when you're considering looking at notes, which one do I code first? Of course, it's the most complex or resource-consuming procedure. Makes sense, right? We talked a little bit about the debridement. We'll look at, I'll bring in that form next week, and we'll take a little tour of that. It is kind of broken down on those different stages as well. Lesions, skin lesions. A couple of different examples of skin lesions, maybe skin tags. When we're talking about skin tags, that's where count comes in. How many tags are removed at the same time? We might be talking about either moles, cysts, herpes. How is this lesion removed? We want to look at that. Does anyone know what ablation is? Ablation. What do you think that is?
Obliteration or something like that.
A good rule of thumb is ablation usually involves laser. Destruction also involves laser, but destruction is totally destroying. Ablation, for the most part, is kind of destroying to the point where it isn't totally destructive. Does that make sense? It's typically done on the surface with laser. Did you have a question, Karen?
Sounds like something will come back. It's not totally gone.
Possibility, but there is a little bit of a difference between ablation and destruction.
Why is that? Why would they do that?
What's that?
Why would they do that?
We'll look at it in the
Okay.
CPT manual. It gets into the different descriptors, and it breaks down certain guidelines for what is considered which.
Okay.
So it's something that you need to be mindful of, and that's why I'm making you aware of it, but it is something that you need to be mindful of. We looked last week at a couple of examples between the benign and the malignant, or not last week, but the week before. So making sure that your classification is in that right section, that's something that you want to make sure of. Of course, we're not going to code something that is malignant as benign. I mean, it's... When we're coding lesions, there are 3 different questions that you should be asking yourself when you're coding them. Again, is it malignant or benign? What site or body part is it located on? Each of our bodily parts, although it's in that section, there may be different subsections for each separate arm. You know, I think one of the questions that we had looked at, or examples that we had looked at, specified the left arm or right arm. So you just want to make sure that you're in the right bodily area, number 1. And you want to take a look at the size. Again, we might be looking at measurements. When we look at the CPT manual, there's a few different procedures that also include margins. What is a margin? Does anyone know what a margin would be if we're talking about a... Sounds like something
It's around the area.
It's around.
area around. Sometimes in order to perform a specific repair, they gotta go a little bit further. They gotta kind of go a little bit further around them. So, and then that's where sometimes graphs come into play. So graphs are also included in this particular section. When we're talking about the nails, who would be using CPT codes for nails for the most part? Podiatry, absolutely. So these are codes that would be specific to that. Now, in combination with the integumentary CPT code, we would also be placing an E&M code because we're providing a service, we're performing a procedure. Does everyone have that kind of clear? An E&M code, the evaluation and management code, applies to the service that's performed. The CPT code applies to the procedure that's performed. Does everybody get that? Make sense?
Not every time you use a CPT code, you're going to have an E&M code.
Absolutely. That would be if you're coding for a physician office, for the most part, you would use both.
Oh, really?
Yes. If you're working at a hospital or an outpatient service, the hospital or the organization codes the CPT, the physician separately codes his EM. I think we talked about that briefly last time we met. That you will have, for one particular patient's episode of care, you may have 2 separate claims. The physician's billing, the organization's billing.
Right. I took it as, when you said that, physician's billing because he has to use that different form. You know what I mean, the 1,500 or whatever?
Yeah.
And then the hospital would bill on the other one, 1,450 or whatever, but they could be billing the same code.
No. The hospital bill, the UB04, which is billed by the hospital, that will have essentially room and board. It will have specific charges to the facility. The codes, which are usually submitted on a UB4, are ICD. The 1450, which is for services provided by the provider, would have the CPT, ICD codes. So you would have both. So there's kind of a hospital claims form is essentially just the ICD. And I think we talked about that the difference between the payer classifications, that becomes a diagnosis-related group. So for those diagnoses, those ICD codes, the hospital's reimbursed for the care that it's, you know, kind of a historical based on that. Does that make sense?
Yeah.
So there is a difference between the 2 forms that are used and the settings in which they're used. So very good question. Does everybody see that now? That you have the difference between the 2 different types of healthcare settings?
So when would the hospital use the
1450?
The CPT code, yeah.
The hospital would not.
Ever?
outpatient would. So it's outpatient ambulatory, 1450, CMS 1500. UB4, which is the 1450, sorry, that is used by the acute care. Okay? Huh? Did you say wow? Well, yeah, but it's good to have the two, know what the two, where they're used. That's the starting point, is to understand exactly where they're used. Because of course, if you're working in an acute care hospital and you submit the CMS 1500, guess what? Right. So, great attempt, but it's gonna come back to you. So with the nails, these codes are mainly used by podiatrists. Some of these procedures in a healthcare organization will only be performed by a podiatrist. They have to have a consultation performed or completed by that particular discipline. So that includes nail cutting, debridement, and any avulsion, again, of nail plate. And again, those T modifiers may come into play there. We may have the different types of treatment for the pyloneal cysts, which is an ingrown hair, number one. There's a number of different ways that they treat those. When they talk about introduction in this particular section, they mean that the integumentary system is introduced with something. It is being introduced. Something is being introduced into the integumentary system. Makes sense, right? There may be different types of injections or tattooing for, say, chemotherapy treatment. There may also be implantation of birth control devices. I think they called it Norplant. So these are found in this particular section because we're implanting into the skin, into the integumentary. It wouldn't be found in the female reproductive system. So, right? It makes, I mean, come on, I know you guys got this. I know you guys got this. Proving that to me. When we discuss repairs that are performed in the integumentary system, again, those definitions and guidelines, we'll take a look at that. That's where they come into play. Is it a simple or a repair? Simple, essentially, is superficial. Intermediate is superficial, but it's non-fascia. It's not into the muscle. And then when we have complex, that's when we're talking about layer. That's usually muscle deep, right? I mean, that's pretty straightforward. In week 1, we talked about how some of the sums of the lengths need to be calculated. Again, keep that in mind when we're doing this particular section. There's 3 different factors that we want to keep in mind when it comes to coding repairs. And they're the length of the wound, how many centimeters is this particular length wound, the complexity of the repair, and then, of course, the site. A couple more tips here on coding that primary code. And again, it's resource-based. So whichever procedure requires the most resources, that would be our primary CPT code on the CMS 1500. You want to group together the anatomical sites. You know, if you have a particular repair that's occurring on the face, again, we're calculating the sum of the repairs. So we're going to group them first. You wouldn't code, you know, face, arm, face, leg, you know, kind of mix and match. You're going to group them, calculate your sums, and then code. Grafts. We do have have different types of tissue transfer, skin grafts, and what they call flaps that are performed. Some of these may sound familiar to the ICD people who have the ICD coding in this particular class. These are characterized by the type of graft, of course, which body part is involved in this particular procedure, and the size of the defect in centimeters. It's okay, did you want me to? Repairs, oh, I'm sorry. What we're gonna, or for the tissues and transfers and grafts, if it's a type of a treatment or a repair that requires any type of skin replacement surgery, you'll see those in this particular section. There's two different types or categories of flaps, and they are either the skin, deep tissue, or they're classified as other. We'll take a look at those in the CPT manual. There's other procedures that are listed in this section as well, and they are considered dermabrasion, chemical peels, and they're based on the particular body site. Those are essentially what they consider cosmetic. What's that?
That sounds like that plastic surgery kind of thing.
Right. So whether or not the third-party payer approves payment for those particular services as well, or procedures, is a lot of the times non-existent. They consider that cosmetic. Again, of course, if you're working for a healthcare organization, one of the things that you are going to want to ask for first is their coding compliance plan. Because the coding compliance plan is going to break down, a lot of those rules and guidelines for you. You don't have to go and do all of your own research and say, well, okay, what types of insurance? They've already got kind of their coding Bible at the healthcare organization where they note tools and tricks for that particular organization. So that's one of the first things that you want to request is that coding compliance plan. Just so that you know, this applies, this doesn't apply. I think I mentioned to everybody that what I would do is follow the most stringent rules, because all of the others, they weren't quite as harsh, but as long as I did the harshest, I knew I was at least covering my bases with the others as well. Okay? Any questions so far? No? Good? All right. Pressure ulcers, I'm going to bring you in an example of that form, but the slide, it's hard to see on this handout. If you look at it on Blackboard in the PowerPoint, it's a little bit blown up. This illustration gives you an example of what those different stages are and what each of those stages actually means by definition. So it's pretty informative. Burns in the CPT manual, for those of you who have had ICD, you know what I mean when I say the rule of nines. So very similar in CPT. It breaks down essentially the percentages of the bodily system that has been burned, okay? We have our different degrees of burns that are defined in the CPT manual. So that may be the first degree, which is just the epidermis. The second degree is dermal. And of course, third degree would be subcutaneous. It's pretty straightforward. You would look at your your documentation to make these determinations, right? And if it wasn't in our documentation, we would query the physician, right? Okay. So when it comes to burns, most of the third-party payers bundle that care into the services that are provided. How the insurance company wants integumentary codes coded, they have their own separate guidelines. Again, that coding compliance manual will let you know. Do they want that